Hello, good afternoon, ladies and gentlemen, dear colleagues, friends, and guests. It gives me the greatest honor and delight to be participating this year in the Egyptian Fertility and Sterility Society annual meeting. I would like to personally thank Professor Gamal Abu Surur and Professor Amr Shalakani, who have extended their kind invitation and consideration for me to be one of your speakers this year. This year is very different to all of us because of course, having the meeting, virtual meeting, rather than in person. And we all know the warmth and the generosity of our hosts. And we always look forward to see them in person next year. My topic for this talk is really whether antioxidants have any impact on the outcome of assisted reproductive technology. This has been a source of investigation and research over the last 10 years, and we are very thrilled and delighted to have extensively investigated its role both in the female and male. Most of the original research was done on the male side because of course, increased DNA fragmentation in many of the men with abnormal sperm morphology. Basically, oxidative stress is a state related to an imbalance between two things, between the reactive oxygen species and between the antioxidants. There are reactive oxygen species that we're all exposed to, whether by our behavior or environment, and also there is antioxidants in the body try to fight them. The oxygen-active species are either free radicals, like basically chemical species capable of independent existence and have basically a single unpaired electron. The reactive oxygen species includes all the oxygen radicals and non-radical derivatives of oxygen. Like what? Like superoxide anion, like hydrogen peroxide, and so forth. What are the sources for these reactive oxygen species? There could be things outside, for example, like smoking or drinking. So excessive alcohol consumption could possibly result in oxidative stress damage. Excessive smoking would also do the same. Infection and inflammation. It is possible that varicocele, for example, could lead to also oxidative stress and so forth. Radiation damage is possibly so. What about endogenous leukocytes, like increased inflammation, excessive immature spermatozoa, Sertoli cells? There is also possible, although not proven, psychological stress, people who exercise on extreme levels, aging in itself. We used to say that there is no impact of age on the male side. I think this is changing, but the mechanism by which age impacts the sperms is still one of the things that we all try to understand and determine. There are things that we do ourselves that could contribute to that. I mentioned again, for example, obesity. Obesity, how does it impact the female infertility? Besides this impact on the ovarian response and stimulation, there is increase in lipid peroxides, there is increase in oxysterols, on oxidized lipoproteins, on fatty acid. There is also increase in insulin resistance. All this could possibly cause oxidative stress and damage. Certainly, excess alcohol results in the decreased glutathione, increased lipid peroxidation, and oxidative stress. Smoking, by a variety of methods, has been shown to also impact male infertility. Malnutrition, and actually today there is more of obesity than malnutrition. Cocaine, I mean, not a problem maybe in some parts of the world, but certainly a problem in some parts of the US. Marijuana, does marijuana impact the oxidative stress balance? And it certainly does. And finally, chemical exposure, like exposure to superoxides, to hydrogen peroxide, and so forth. So all these are basically factors that affect the sperms. that we can assist. For example, for those smokers and drinkers, they can decrease the amount. It is very difficult, we all know, to quit smoking completely, but there is not just a threshold, there is an impact of the amount of smoking. Similar to the cardiac conditions that we have noticed. Again, for drinking, there is a difference between healthy drinking, which is, for example, 1 glass or less of wine per day, versus excessive drinking, which could definitely be harmful directly by itself, also by affecting liver function, and as well by increasing the net weight gain and contributing to overweight and obesity, as we show here. So what is oxidative stress? It's an imbalance. It's an imbalance between two things, between the antioxidants that we naturally all have and between the radicals that we have. So reactive oxygen species in moderate amount, in mild amounts, is important for normal cellular function. And it is the disruption in this physiologic balance that leads to infertility or leads to a deterioration of an already existing sperm problem. Its role in male infertility has been well established for a long time. The female infertility oxidative stress biomarkers can be found in female reproductive system, peritoneal fluid, amniotic fluid, and of course we're all very familiar with hydrosalpingeal fluid. We all know that it decreases the implantation. So you can still have good embryos, but the impact of the hydrosalpingeal fluid, if it trickles back through the cornea of the uterus into the uterus and causes some damage in infertility by decreasing implantation and increasing pregnancy losses. How do we check it? As you can see, that there are many ways to check it, from ELISA to total antioxidant capacity to immunohistochemistry, Western blotting, enzymatic antioxidants, flow cytometry, chemiluminescence, and many other ways of detection. For the male side, for example, the Myoxis was developed by the Cleveland Clinic, and it has played a role in simplifying the assessment of the reactive oxygen species. How does ROS affect the gametes, whether eggs or sperms? Many steps could be affected. For example, by DNA cross-links, by single and double-stranded DNA breaks, by rearrangements of chromosome, by modification of bases, production of base-free sites, denaturation and DNA-base pair oxidation. All these are different mechanisms for DNA damage in bioreactive oxygen species. So is there something good about it? Yes, it does play a physiological role, like in hormone signaling, in oocyte maturation, in corpus luteum function, in implantation, and so forth, as we will discuss with you today. What about, for example, in female? I will focus in the next few minutes in my talk on the physiologic function, and then present to you two studies that has been very recently published. One by David Gardner from Melbourne, Australia, showing you the impact of adding antioxidants to the culture media, that has just been published this year in May in Reproductive Biomedicine Online. The second is actually our study, which is a controlled study on the impact of antioxidants supplementation on women undergoing assisted reproductive technology. So a brief outline of the physiologic role. Reactive oxygen species again play a role in oocyte maturation, in folliculogenesis, in ovarian steroidogenesis, and luteal function as well. The different antioxidants that we are very familiar with, for example, like vitamin C, vitamin E, and so forth, have played a major role so far. But then we will focus today on some additional antioxidants like acetylcysteine, like carnitine, and alpha-lipoic acid. What about the endometrium? We've done some work on the oxidative stress in endometrium. And basically what I want to share with you today is two things. That the reactive oxygen species may activate the nuclear factor kappa B, which stimulates the cyclooxygenase 2 messenger RNA and prostaglandin F2. The impact of decreased or basically hypoxia on different factors in the endometrium is important. So let me summarize to you what we have found. That in the left side of this cartoon, there is a situation basically where implantation occurs or does not occur. So the left side is when no pregnancy happens and you have low HCG and hence you have low progesterone. When you have low progesterone, you have a decrease in the superoxide dismutase, you have an increase in the oxygen radical, an increase in activating factor, an increase in cyclooxygenase and PGF2 alpha. On the other side, when pregnancy happens, HCG is produced by the syncytial trophoblast. It results in increased progesterone production by the corpus luteum, an increase in the copper zinc superoxide dismutase. This in turn decreases the oxygen radical, decreases the activating factor, decreases the cyclooxygenase, and decrease also the PGF2 alpha, which is partly involved in the menstruation process. So you can see how here that the implantation by having the embryo implanting in the uterus produce HCG, which in turn increase progesterone and the cascade of events that you see in the section B of this cartoon. So successful implantation is the first step by production of HCG, maintenance of progesterone level. Progesterone increases the activity of the superoxide dismutase in the endometrium and so forth, as I have demonstrated to you today. What about endometriosis? Endometriosis in particular has been thought to have a high oxidative stress. This is not just as a result of the heme or the iron. The iron itself has no direct link to the reactive oxygen species per se, but may be associated with the catalyzing reaction of free oxygen, of free radicals as well. What about polycystic ovaries? And these are not our two topics for today, but oxidative stress has been found also in PCOS, and antioxidant levels are diminished. And this has been thought to be one of the causes of mitochondrial dysfunction. Finally, what about infertility? Infertility is an important balance between factors that are promoting, like normal ovulation and normal sperm function, and factors that are inhibiting, including damaging factors, as we mentioned, and oxidative stress as well. Does it have an impact on ART? Does oxidative stress has an impact on ART? It could, because it could affect the ovulation process, could affect the implantation, and finally, we think that it does have an impact on the embryos. So the two studies that we had, the one by David Garner, looked at addition of antioxidants. 3 antioxidants were added to the culture media, in addition to the G media, the Garner media. And in the control group, no antioxidants were added. In our study, we supplemented antioxidants, as I'll share with you, to the patient for 3 months prior to their IVF. And we had a control group of women who did not have supplementation in a historical group just immediately prior to the phase of the study. So is the impact of oxidative stress on the gametes or on the embryos? That we will try to show you in the next few minutes here. Because we are not presuming in those studies that it will have an impact on the ovarian response. So we just concentrated the 2 studies that were presenting on the events from the egg pickup up to the point of pregnancy and blastocyst implantation. All the 2 studies looked at implantation of blastocysts and steps prior to that, like the quality of the embryos. You can have actually, like I mentioned, a balance or an imbalance, and this imbalance could be favored in favor of the oxidative stress, particularly in the group of women that is undergoing ART, because there are some additional steps that may induce oxidative stress in the IVF lab that might not be normally present in the female reproductive system in healthy women that do not have infertility. So what are the strategies that are used? There are many strategies. Lewis, for example, the low oxygen tension that all of us are doing now is one of those strategies as well. Does the antioxidants protect the oocytes? We think it possibly can, but again, we are looking at the steps from the oocytes onwards as well. There has been studies, but those studies have been part of the old studies from 1990 till the present time. So the two studies that I'm presenting you today are 2020 studies. And basically, there is a clinical study, which is ours, that we looked at the addition of oral antioxidants for 3 months prior to IVF. And then there is a IVF lab study, which include the addition of 3 antioxidants, as I will share with you, to the culture media just during the 5 or 6 days of the embryo growth in the IVF lab. This was conducted by Dr. David Gardner in Australia as well. The primary objective of Dr. Gardner's study, which was published in RBM Online May this year, was whether the inclusion of 3 antioxidants, acetylcarnitine, acetylcysteine, and alpha-lipoic acid, would improve the primary outcome as determined by the quality of day 3 embryo, as well as the quality of blastocyst on day 5 and 6, and then finally the clinical pregnancy rate. Was a prospective randomized multi-center study comparison of sibling oocytes. Totally, there was about 1,563 metaphase 2 oocytes from about 133 patients. The study group, they had supplementation of the IVF and the culture media with 3 antioxidants, again, carnitine, acetylcysteine, and alpha-lipoic acid. The control group had the same IVF team, same embryologist, and same culture media, but without the use of antioxidants as well. They look at good embryo quality on day 3. They find as basically 8 to 10 cells and very low fragmentation, good quality blastocyst, at least 3 BB or greater, clinical pregnancy rate, which is the gestational sac per embryo transfer or oocyte recovery or start of the IVF cycle. This is the results of the Australian study. When you look at the G-series media alone and the G-series media with the antioxidants, you find on day 3 embryo, there is a good quality, again defined as 8 to 10 cells with low fragmentation, 40% or 41% in the G-series versus 50% in the antioxidant supplemented group. And then when we looked at the presence of fetal sac and then cardiac activity, the fetal sac was 39% versus 51%, and then the cardiac activity 38% versus 47% as well. This put you into those bar charts. You look on the left side, there is the day 3 embryo, there is in the middle, the gestational sac, and then on the right side, the cardiac activity, which we all look forward to see as well. When we look at the gestational sac, and cardiac activity and ongoing pregnancy rate, we looked at women below 30, below 35 and women above between 35 and 40, and you know there is indeed a significant difference in the group of women between 35 and 40 when they had antioxidants added compared to the usual culture media without the addition of antioxidants. So you can see here that the addition of antioxidants resulted in a 57% gestational sac per embryo transfer in women that had the antioxidants versus 23%, cardiac activity 50 versus 23, and the ongoing pregnancy rate is the same ratio. So I just want to contrast that with this one, that when we separated the group of patients that are 35 to 40, there was a marked improvement by the addition of antioxidants, suggesting that it is possibly one of the mechanisms of deterioration of infertility, besides all the things that we know, like ovarian reserve and euploidy, is the actually the preponderance of oxidative stress in older women. So again, looking at it into a bar chart, looking on the left side, gestational sac, cardiac activity, and ongoing pregnancy rate, and the two colors are distinct, the G series media versus the G series with an antioxidant. I put here the one of the books that I had the pleasure of doing with David Garner 10 years ago, and Tommaso Falconi from the clinic, where we contributed to the clinical side of IVF. He contributed to the lab side, and Dr. Falconi to the surgery side by the robotics and other things. What I want to tell you here, that basically the IVF lab makes it or breaks it, and the not just the culture media and many of the things that we have all done in the past 25 years have made a huge difference compared to the first 15 years of IVF. In conclusion of this study, that the presence of antioxidants during IVF and embryo culture, results in a significant increase in implantation, particularly for women between 35 and 40, and therefore the supplementation to the IVF and culture media may possibly improve the viability of human embryos in ART, possibly through the reduction of oxidative stress. Again, this is one study that added to our knowledge in this field. The second is our study. The primary objective was to see, again, clinical pregnancy rate defined by the presence of gestational sac per embryo transfer, per oocyte recovery, and also per initiation of the IVF cycle. We also look at the blastocyst formation rate and the fertilization rate. There were two groups that basically involved here. The study was done between October 2018 and in this analysis that I'm presenting to you is showing you the results our results up to July 2020. So these data were compared to a similar cohort of patients who underwent ART in the preceding 18 months. We consider those historical controls. There has been no change in the lab protocols, no change in the lab personnel. The only difference is that we added the supplementation of antioxidants from October 18 till now, and then compared it really to the 18 months prior to that. We included all the patients between the age of 21 and 40 that were ready to be consented for that and completed a study questionnaire. We did not exclude any racial or ethnic group. The study was done in Texas, and hence there was an increase in the Latino group, so as to speak, in this study, not because of our selection, but simply because of preponderance of Latino patients. So in Texas, the majority of patients were Latino, and then white patients or Caucasian patients would be the second group as well. We excluded anybody that had surgery in the past month, and anybody that had cancer, and anybody that had significant trauma, car accidents, and so on, or have chronic inflammatory condition, because we think that this might possibly affect the IVF through its impact on the inflammatory side. So again, anybody that took on their own any antioxidants in either group by their own wish or by their own habit, then those were excluded as well from the study. We screened 384 actually patients up to now, from during that period of time. About 122 patients were interested in the study enrollment, so we collected the basic demographics, we reviewed their medical history, we looked at their medications, we looked at the nutrition supplements, and so on. In the US today, perhaps 1/3 of all medications or all supplements that are used are over-the-counter supplements or online supplements and not prescriptions by medical doctors. Eventually, we had 76 patients that met the eligibility criteria and had basically did an written consent and took 90 days of supplementation before their egg pickup. Basically, we looked at 102 IVF cycles. 51 of them had supplementation, 51 were controlled, so like I mentioned, from the historical control. Those people who have agreed, have signed consents, and were not excluded by any of the simple exclusion factors that I mentioned. Up till July, 33 had completed their IVF cycle, and their IVF cycle, there is a trend over the last 2 to 3 years that we do a freeze all, whether they do PGT or not, and then we do a single embryo transfer, single blastocyst transfer in one of the subsequent cycles as well. And these are our results in the period of October 2018 to July 2020. Basically, 33 subjects, the 33 IVF patients had 90 days of supplementation and went through IVF during that period, and they were compared with matched controls of 33 patients in the previous 18 months, matched for age, matched for weight, because as we know, obesity increases the inflammatory tendency. The fertilization rate was slightly higher, but did not reach statistical significance, was 64% versus 58%. The blastocyst formation rate, basically half the patients reached blastocyst, so approximately 43% versus 37%, again an increase, but no statistical significance. And you can understand also when you have about half the embryos reaching blastocyst, it is difficult to move that forward. When we look at clinical pregnancy rate, out of the 33 patients that underwent supplementation with antioxidants, 22 of them had implantation and gestational sac, compared to only 12 in the control group. So this is in bar format. The supplementation group are the blue, and the orange are the women who did their IVF in the 18 months prior to the supplementation group. And you can see here that in the fertilization rate was much higher in the supplementation, but what did not reach statistical significance. Blastocyst formation did not also reach, but the clinical pregnancy rate was highly significant as well. So we concluded that the supplementation might result in an increase in clinical pregnancy rate. Based on David Garner, the impact was much more significant in the 35 to the 40 age group. We are looking into that, the age groups, particularly when we have the 51 in each group completed the study, then we would have a good number, a significant number in each group. So really 2020 has seen some evidence in both clinical side in our study and the IVF supplementation study and the Australian study that suggests there is an improvement in pregnancy rate. We definitely need more clinical randomized controlled trials, larger, and this could be multi-center, where we would need to include several thousand IVF patients to result in several hundred that were supplemented and others that were not. At this point in time, I want to say that that antioxidants remains in the group of supplements or medications that are controversial still in IVF because of the different outcomes of the studies that were done in the 90s and 2000s. However, I want to say that the change in the laboratory practices in the last decade has made significant change in itself in a reduction of the oxidative stress by using low oxygen tension, by lower exposure to for example, on the male factors of the eggs to the sperms. And hence we hope that that very soon more randomized control studies come, and this does not become part of the controversies as we have discussed in the book by Dr. Yaqub Khalaf and myself that we published this year as well in March of 2020 in London. So I want to thank you all for your opportunity to be part of your great meeting. I'm very proud of the Egyptian Fertility and Sterility Society. Professor Gamal Abu Surur have always made it one of the classic international meetings that everyone would like to attend. I thank Dr. Amr Shalakani for always considering me for the prestigious meeting. I want to say that many of the things that we do today were considered very controversial years ago. I mean, look at, for example, antagonists in IVF. I mean, at the beginning, I was one that was fully opposed because we had excellent results with the agonists. Today, we used in the antagonist in the majority of cycles. It is possible that in the future, we will be using antioxidants, whether as supplement in the culture medium, and you can refer back to the RBM online study in May of this year, or to our clinical study that you will see more details of the study in the next March meeting of the Pacific Coast Reproductive Society. I wish for all of you health and happiness in this year and in these unusual times. I look forward, perhaps, maybe to see you in 2021 for more meetings, and I tremendously appreciate the opportunity always to be part of your prestigious society. Your names are always, internationally brought with pride and with tremendous satisfaction as sound, robust scientific society. Again, many thanks, and I look forward to perhaps the live discussion on November 27, the day after Thanksgiving this year. Thank you so much.